everyone. We've got BB here. BB has come in for his annual vaccinations today, and we wanted to just give you an idea of why it is important to do annual vaccinations or to get a general checkup. Now, obviously, vaccines are given to prevent certain viruses, but what is really important is actually the checkup involved when they get their vaccines and having a good kind of exam at the time that they get their vaccinations. Now, we generally have their details up, so we know that BB is a 13-year-old and he's a neutered male. So, you know, he's a little older, so we want to be kind of checking out his mouth, having a listen to his heart, having a feel of his tummy. Those are the types of things that we'll be doing. And so we start generally tip to toe, and now when we look, he's not very happy with his mouth being looked at, and that's because when you have a little look in here, you can actually see how red and angry his teeth are, and that and how sore his gums are. He's got some thick what we call tartar, which is calculus, sitting on there. And he's actually quite painful. So he immediately we can see that he actually is a candidate to have a dental, so that we clean those teeth up, and potentially sometimes if they have holes in them we have to remove those teeth too, because all that bacteria is sitting on those teeth, but it's also going into their system all the time. And if there's a weaker area which you specifically find in an older patient, then it will go and sit there, and it can make things a lot worse. So teeth is a good starting point. We'll also have a little listen to his chest. Yeah, and his chest sounds fine. We're listening for any heart issues, little murmurs, anything that might sound a little bit different, that might alarm us, especially if we are looking at considering doing a little procedure. Have a little feel of his legs, his joints, his coat. Make sure that there aren't any sort of funny lumps and bumps that might be something that we do need to check out, especially again with an older patient. Because we can get masses on the skin, and they can sometimes not be nice things, so we want to catch them early, and then have a good feel of his tummy, which also feels okay. He's got a big bladder, so he does need a wee, and then we also will get his temperature, which we don't need to show you, but he's not gonna like it very much. Little temperature check, BB. Sorry, my boy. Sorry. Okay, and that temperature is fine as well. That's 38. And then what we do is we check his microchip is reading. So we have a scanner, and we'll scan over him, check that his microchip is reading, which it is. He has a number. And then we will go ahead and give him his vaccination. Good boy, my pupsy, good boy. Little pinprick. There we go. And that's it. So he's had a full clinical check. We will be needing to see him again for his teeth, but otherwise he looks really good.